Hi, hi everyone. So I'm a little flustered right now because I just spilled water all over my desk. Um, in my effort to get here at 12, I moved my computer and knocked water over. Um, Best laid plans, right? So anyway, so now my mouse isn't working correctly. Oh, the life, the life. So anyways, welcome to day three. So of Dr. Greger's daily dozen what lives on what we should be including in our diet. So today is fruits, one of my favorites, one of all of our favorites, right? So yesterday was berries, but this is kind of other fruits. So whereas berries are a particular its own category, this is other fruits. So anything from apples, avocados, which are actually a fruit, bananas, cantaloupe, oranges, lemons, clementines, dates, figs, nectarines, papaya, mango, pomegranates. You think of it, it's good. The serving size is one medium-sized fruit, a cup of cut-up fruit, or a quarter cup of dried fruit, and the recommendation is 3 servings per day. So why is it recommended? Why is it included on his daily dozen? So kidney disease is one of the reasons. So the standard American diet, or what we often refer to as the SAD diet, yields an acidic urine. All that acid, the amino acids that is in the animal protein. So most animal products are really acid producing, and most fruits and vegetables are acid reducing or alkaline. So this is really important when it comes to kidney function as well as kidney stones, as it lowers uric acid buildup. So there's so much data on that. Eating a plant-based diet with fruits in particular decreases the incidence of kidney stones as well as the overall burden on the kidneys. So it's really important for kidney disease. Diabetes has shown greater consumption of whole fruits is usually associated with a lower likelihood of developing type 2 diabetes. So many diabetics, it drives me crazy, are told stay away from fruit because there's sugar in fruit and you need to avoid sugar. So anyone who has diabetes should come to my diabetes talk, which is going to be toward the end of May, and I'll post that shortly. But the sugar is really the symptom of diabetes, it's not the problem. So getting to the underlying cause of diabetes is really what you need to worry about, and not limiting your amount of fruit. Fruit is just so good. All the phytonutrients and the fiber in it. Actually, the number one thing that I tell, other than stopping dairy, for my diabetics is the first thing they should do is actually increase their amount of fruit, put more fruit. The enzymes in the pectin and the lining of fruit is very good for blood sugar control. So also stroke risk. Citrus fruit intake has been associated with a reduced stroke risk. So increased intake, decreased stroke occurrence. It appears to be related to a phytonutrient called hesperidin, which appears to increase blood flow throughout the body. So not just for stroke, but also for heart disease. One of the most important things, and I talk about this in my cancer talk, is that it boosts DNA repair. So all day long, on average, humans appear to suffer about 800 hits to their DNA per hour. And it is these small insults to our DNA that, if they're not repaired, they cause mutations that lead to cancer. So we need things that are kind of going to go around and clean up those damages and stop it from turning into cancer. So, and the best dietary factor to boost DNA repair has actually been found to be citrus. So consumption of citrus alone independently has been shown to be associated with a lower risk of breast cancer. So another surprising one is actually lung function, but this makes sense if you think about also in GI function. So there's data going back 50 years really that shows that a high intake of fruits and vegetables is positively associated with good lung function. Just one serving of fruits each day can decrease the risk of dying from COPD by 24%. That's like if we had a pill that did that, it would be a bestseller. There have been studies both on COPD and asthma that showed increased fruits and vegetable consumption really slowed disease progression, particularly for COPD, and exacerbation rates for asthma. And this is really having to do with the thought about the antioxidants and inflammation of the lining of the lung, which is really very thin, and that's what I was saying, similar to the GI tract, is very thin. So the antioxidants preventing inflammation there. So as we were talking about yesterday, it's all about antioxidants. Antioxidants is where it's at, and you get them in fruits and vegetables. Okay, so now some specific fruits. I just want to say dates. Why have I never really heard of them? Okay, and before I went plant-based way of eating, apparently my grandmother had date squares, which were amazing. And maybe I don't know, maybe I was afraid of date squares, or they looked funny to me. But I did not really know about dates until I went plant-based, and they are amazing. They are just a perfect little hit of sweet. I love to have, if I'm craving something sweet, I'll have keep dates in my freezer, and I'll have a date with a little bit of almond butter in there. So good. So I keep them ready to go in my freezer. Now olives are considered fruit. They are fruit, but they're fruit from the tree. But they are soaked in brine, so you're not supposed to eat them fresh straight from the tree. So it will really increase your sodium intake about 12. If you were to have 12 large olives, it would be about 50% of your daily sodium intake. So really should be an occasional treat. Now olive oil, everyone always asks about olive oil. It has no sodium, so that's good, but most of the nutrition has been removed. So, all the fiber's gone. It's a heavy caloric load for little to no nutrition. So 1 tablespoon is about 120 calories. Dried fruit is okay without sugar added. That's fine. Going back to the olive oil, so Dr. Greger likes to think about olive oil as the table sugar of the fat kingdom. So it's like, beet sugar comes from beets or sugar cane, and they take away all the good stuff, all the fiber, all the phytonutrients, and then leave you with this one little thing, similar to oil. So like corn oil, they take all the fiber, all the good stuff out of it, and you're left with oil. So similar. So I like that comparison. So if you like drinking your fruit, juice is not the way to go, because again, that gets rid of all the fiber and all the nutrients. So blending is better than juicing, as the nutrition is maintained. Juicing just removes all the fiber. And studies have shown that most of the phytonutrients are actually bound to the fiber. So when they get released in the gut. So when the fiber that we can't absorb, but that our good gut bacteria can. So if you get rid of the fiber, you miss out on those phytonutrients. So there's only one caveat about fruits that I like to just put in here. Grapefruit. So about half of, if you're on prescription medications, about half of our prescription medications interact with grapefruit. It has to do with the enzymes in the liver. So if you are on prescription medications, you should either avoid grapefruit juice or discuss it with your medical provider. So that's it for fruits today. If you have any questions or you have any favorite fruit recipes, drop them in the comments below, and I'm happy to share with everyone and answer all your questions. I hope everyone is having a great day, and don't spill water on your desk. Okay, take care.